So let's start. Before talking about the pre-Achilles, fat pad, and bursa, you need to know the posterior compartment of the leg. The posterior compartment of the leg is formed by two muscle groups. The deeper one is formed by three muscles: tibialis posterior, which is related to the posterior aspect of the tibia and fibula, flexor digitorum, and the flexor hallucis longus. The flexor hallucis longus is the most superficial muscle here in this group. Okay, don't forget this one, that the flexor hallucis longus is the most superficial muscle in this deep muscle group. The superficial muscle group here is formed by two muscles. The deeper one is the soleus muscle, and the superficial one is the gastrocnemius muscle, which has two heads: the medial head, which is on the same side of the tibia, and the lateral head, which is on the same side of the fibula. So this is the superficial muscle, the gastrocnemius muscle. So these muscles, the tendons of these muscles, will join to form the Achilles tendon. So the tendon of the gastrocnemius muscle. Okay, this is the gastrocnemius muscle, and this is its tendon. And the deeper muscle here is the soleus muscle. Here is the soleus muscle. Okay, and here is the tendon of the soleus muscle. So the tendon of the gastrocnemius muscle will join the tendon of the soleus muscle to form the Achilles tendon. Here, the Achilles tendon, which will attach these muscles to the posterior aspect of the calcaneus. Okay. Now, what's happening here on the posterior aspect of the ankle? The superficial group of muscles is separated from the deep group of muscles. So the deep group of muscles, or their tendons, the tendons of the deep group of muscles, is separated from the tendons of the superficial group of muscles to surround this triangle. What is this triangle? The king. Okay, because everyone is separated to leave a space for him. This is the Kager's fat pad. Another name, as can you see, this fat pad is this fat pad is pre to the Achilles tendon, so it's called the pre-Achilles fat pad. And it is retro to the calcaneus. Okay, so it is the retrocalcaneal fat pad, or pre-Achilles fat pad, okay, or Kager's fat pad. So this fat pad is bordered now by the most superficial muscle, in the deep muscle group of the posterior aspect of the leg, which is the flexor hallucis longus. So this triangle is bordered anteriorly by the flexor hallucis longus tendon, bordered posteriorly by the Achilles tendon, bordered inferiorly by the superior aspect of the calcaneus. This is the most important part because you will find this triangle as long as you draw a line here as the base of the triangle. So if you draw a line here as the base of the triangle, you can now detect the triangle of the Kager's fat pad. So starting here, you will now detect the triangle. Okay. So here's the triangle is okay. So you need to know first that the triangle is full of fat. It's a fat pad. So it contains fat. So it will be a translucent. Okay, it will be a lucent triangle on the X-ray. Okay, lucent or translucent triangle on X-ray. It will show high T1 signal on T1. Okay, so this is the high T1 signal of the fat inside the Kager's fat pad. And if you draw a line here, you can detect the triangle. If you draw a line here, you can draw the triangle. And it is of normal high T1 signal of its fat content. Okay, so what about the stir image? If you draw a line here on the superior aspect of the calcaneus, you can now draw the triangle. This is the triangle. Okay, this is not the triangle, this is the muscle. This is the muscle. Okay, the muscle is always of intermediate signal, as you can see here. The fat of bright signal on T1 and of suppressed signal on stir image. This is very important because you will detect all abnormalities within this triangle only on the stir image, because this triangle should be black signal, as you can see here, of very dark signal on the stir image, because the fat signal will be suppressed on the stir image. So any bright signal is either edema or bursitis. Okay, so this is the parts of the calcaneus, because as I mentioned, you will try to find the superior aspect of the calcaneus so you can draw the line. So what are the parts of the calcaneus? Posterior process. Posterior process. This is very important here in this topic. Posterior process of the calcaneus. So can you look at the posterior process? So this is the posterior process of the calcaneus. This is the anterior process of the calcaneus. This is the apex in between. So the calcaneus now have three parts here: anterior process, apex, posterior process. And between the anterior process and the apex, this is the subtalar joint. This is the subtalar joint. This part will form a part of the subtalar joint. Subtalar joint is very important. The joint that is between the calcaneus and the talus is the subtalar joint. Okay. This part, which is between the apex and the posterior process, is the superior aspect of the calcaneus, which will form a part or a border, the inferior border of the Kager's triangle. Here is the calcaneal tuberosity, and this is the body of the calcaneus. Okay. This image shows the Kager's triangle here, and this is the superior aspect of the calcaneus. This is the high signal of the fat content of the Kager's triangle. The Kager's triangle is bordered anteriorly by, can you see this? This is a tendon. This is a muscle. The muscle is of intermediate signal. The tendon is black. The tendon is always black. This is the muscle. So the anterior boundary of the Kager's triangle is flexor hallucis longus muscle and its tendon. Okay, flexor hallucis longus muscle and its tendon. The Kager's fat pad is bounded or bordered posteriorly by, this is the Achilles tendon. What about this? This is the soleus muscle. Soleus muscle, which is the deeper muscle in the superficial muscle group of the posterior compartment of the leg, soleus. So here, this is the soleus muscle, and this is the Achilles tendon. This is the flexor hallucis longus muscle, and this is the flexor hallucis longus tendon. And here is the superior aspect of the calcaneus. Okay. So now you know where to find the pre-Achilles fat pad. Where can I find the retrocalcaneal bursa or pre-Achilles fat or pre-Achilles bursa? Where? Within the base of the pre-Achilles fat pad. Okay, so this is a stair image. That's why the pre-Achilles fat pad is of suppressed signal. Okay, so where to try to find the pre-Achilles bursa? Pre-Achilles bursa is normally not seen. It's only seen if it's inflamed and distended with fluid. So the bursa will be seen at the base of the triangle because it is related to the bones here. It is related to the bones and the joint here. So you will find the retrocalcaneal bursitis as you can see here at the base of the triangle. This is the retrocalcaneal bursitis. I will try to find another case of retrocalcaneal bursitis. Yes, here's another one. This is the retrocalcaneal bursitis at the base of the triangle. Okay, if you try to draw a line here, you can find the angle here. Okay, the angle here of abnormal signal, but this is the retrocalcaneal bursa. Okay, bursitis, inflamed and distended with fluid here. Okay, yes, this is a retrocalcaneal bursitis at the base of the triangle. If you try to draw a line here, this is the triangle, suppressed signal now. Stare images, okay. Can you see the bursitis here? It's always related to the bone, okay. So here the retrocalcaneal bursitis. So we now can find the fat pad and the bursitis, okay. So how to know that the fat pad is inflamed? So this is the normal fat pad. This is the normal pre-Achilles fat pad on X-ray. It's translucent here, as you can see. How about this one? The fat pad here is infiltrated by edema. The fat pad here is infiltrated by edema. Okay, so there is edema infiltrating the pre-Achilles fat pad. Once you see this sign, try to look at the Achilles tendon. So this is the normal Achilles tendon thickening. Okay, this is the normal Achilles tendon. If you try to draw a line here, okay, it will not disrupt the base of the triangle. Okay, here, can you see the thickened Achilles tendon here? If you try to draw a line here, it disrupts the base of the triangle because the muscle is protruding into the triangle of the Kager's fat pad. Okay, so here there's thickening of the Achilles tendon. Here, this is the Kager's fat pad, the normal high T1 signal of the Kager's fat pad. Here, the Kager's fat pad is infiltrated by abnormal low T1 signal, means that the Kager's fat pad is infiltrated by edema. So try to now look at the Achilles tendon. It is thickened. If you try to draw a line here, it will disrupt the base of the triangle. It will disrupt. So now you know how to spot the pre-Achilles fat pad edema and how to spot the retrocalcaneal bursitis. So let's talk now about how to spot the Achilles tendon rupture. Okay, so here can you see this is partial tear of the Achilles tendon. There is partial tear here of the Achilles tendon. Some fibers are disrupted and other fibers are inserted normally into the calcaneus. Here there is complete rupture of the Achilles tendon, complete disruption at its insertional area into the calcaneus, complete rupture. Okay. There is thickening at the distal fibers, there is thickening at the distal aspect of the Achilles tendon with abnormal high signal, means there is partial tear of the distal Achilles tendon. Thickening and abnormal high signal at the insertional area of the Achilles tendon means partial tear. Okay. So if you find pre-Achilles fat pad edema with retrocalcaneal bursitis, with Achilles tendon disruption, and the reason of all of these findings was the Achilles tendinosis, this is Haglund syndrome. Achilles tendon disruption is caused by degeneration of the Achilles tendon. There is diffuse thickening of the Achilles tendon. The Achilles tendon is degenerated. That's why there is disruption of the tendon, and that's why there is retrocalcaneal bursitis and pre-Achilles fat pad edema. So here this is called Haglund syndrome. If the reason of this is calcaneal beaking or spare, this is called Haglund's deformity. Calcaneal beaking or spare. So this is the calcaneal beaking or spare, and this bony spare is the reason of the disruption of the calcaneal, the disruption of the Achilles tendon, and the retrocalcaneal bursitis, and the inflammation here and the edema infiltrating the pre-Achilles fat pad. The spare is the reason of all of these. So this is called Haglund's deformity, because there is a deformity here of the bone. Deformity, Haglund's deformity. Another one, this is the calcaneal spare or beaking at the posterior superior aspect of the calcaneus, calcaneal spare, and it is the reason of the pre-Achilles bursitis or retrocalcaneal bursitis. As you can see on the stair image, it's seen as bright signal on the stair. And this spare is the reason also of, this is the fat pad. This is the fat pad edema. Why? If you try to draw the line here, this is the fat pad, should be suppressed, should be of suppressed signal. It is fat, like this, should be of suppressed signal at this one. It is not completely suppressed. There are areas of abnormal high signal. Means that there is edema infiltrating the pre-Achilles fat pad. Here, this is the pre-Achilles fat pad. It is also of heterogeneous signal. It should be of high signal. okay, like the bone here. No, there are areas of decreased signal here, okay, and gives the heterogeneous appearance of the fat pad here, indicating edema infiltrating the fat pad. And the spare here, the calcaneal spare or the calcaneal beaking, is the reason of all of these findings, and it is the reason also of the thickening, the focal thickening here, and the abnormal high signal within the distal aspect of the Achilles tendon, indicating partial tear. So this is called Haglund's deformity, because there is a calcaneal spare. Oh, I think that's all. Yeah. Here's another example. This is if you try to draw a line here, this is the fat pad. Okay, the fat pad should be of suppressed signal as the bone. No, this fat pad has abnormal high signal on the stir image, indicating fat pad edema. And here is at the base of this fat pad, there is a collection here indicating retrocalcaneal bursitis, and there is complete disruption of the distal aspect of the Achilles tendon at its insertional area into the calcaneus, indicating complete tendon rupture. So these features or these imaging features are consistent with Haglund's syndrome, not deformity, because there is no here spare or beaking. This is Haglund's syndrome. Okay, I think that's all, and thank you.